Hello, everyone. This is Nayiri from Low Carbon Fasting. Now, if you're new to me and to this channel, we obviously cover all topics related to low carbohydrate lifestyle, including fasting, intermittent, extended, etc. But because I'm a type 1 diabetic, I cover type 1 diabetes quite a lot in my videos. If you go to the channel and click on the videos, you'll see all the type 1 interviews I've done with professionals. So you might wonder who today's guest is. Today's guest is a naturopathic physician, a nutritionist, BJJ athlete, that's Brazilian Jiu-Jitsu. He's an avid traveler. He's an US Army veteran from Connecticut, and he is type 1 diabetic. So of all the things I could talk to him about today, including his extraordinary travels, I've chosen to talk about type 1 diabetes because we need to raise awareness of type 1 diabetes. There are so many people out there who still don't know about type 1 diabetes. They mix type 2 and type 1 together. They don't know how to manage it properly. So today's conversation is going to be very exciting. I'm seriously excited about it. We're going to cover everything related to type 1 diabetes. Dr. Ryan Attar, welcome to Low Carbon Fasting.
Hey, yeah, thank you so much for having me.
Yeah, I'm very excited to have you, and thank you so much for accepting my invitation. Well, one word I missed in my introduction: you're not only type 1 diabetic, you're an exemplary type 1 diabetic.
Thank you, thank you.
You are exemplary. You have perfect control of your type 1 diabetes. But let's start with your diagnosis story. So you were.
And you know what? One thing I want to say though is that I don't think what I do should be called exemplary. It should be called just normal. I have normal blood sugars.
Yes, you have normal blood sugars, and your A1C is in non-diabetic range, which actually should be normal, but it's unusual. That's the reality. Yeah, still unusual among type 1 circles. So, so you were a young man, healthy, fit.
Yep.
You were a captain in the US Army, and I believe you were deployed somewhere, and then bam, you fell ill and you were diagnosed with this life-changing condition with type 1 diabetes. So tell us more about how you were diagnosed.
Yeah, so I was age 27, and I'm 42 now. And when I was diagnosed, I was in the Army and stationed at the time in Germany. So we have a lot of American bases all over the place. We tend to never leave wherever we go. So we're still in Germany too. And it was great. I really had a great experience living over there. And I had deployed to Iraq a couple of years earlier, but at the time I was just stationed and working in Germany, and came down with all the classic symptoms: polyuria, polydipsia, meaning I was drinking tons of water and peeing a lot. And yeah, I went and got checked out, and they said, you're probably a diabetic. And surprise, you never expect to come down with that when you're young and otherwise healthy. But yeah, they said diabetes. That was the diagnosis. So I went to the hospital and got the standard treatment that we all got and we all continue to get when we go there, including a little bit of education about how to eat and take your insulin. And really, how to eat is just eat the standard American diet. And and we're going over the diet with the nutritionist at the hospital, and everything is count these carbs, take this insulin, count these carbs, take this insulin. And I, at that time, knew nothing about health or nutrition or diabetes. And, I was otherwise pretty healthy and ate good food, but knew nothing about it. And, they kept mentioning carbs and things like that. And I'm like, do you want me to, and I'm very disciplined with my diet. And something too about me and diet too, is I've always been very, very, very disciplined, because when I was a kid, all through high school, I was a wrestler, and wrestlers have to cut weight. And so as a kid and through high school, I was always doing that, and I was very disciplined with it. So I can eat any way. Yeah, if there's a way that I can eat that's going to make me healthier, I'll do it. Like I'm disciplined that way. So yeah, I asked them, I'm like, we keep talking about carbs and stuff like that. Do you want me to just stop eating carbs? And they said, no, absolutely not. You need those to survive. You need those to be healthy, and it won't do you any good as a diabetic. And that was actually the doctor, the endocrinologist, told me that. And that's that's how I started. Like there I was, ready to do whatever it takes to have great blood sugars and normal blood sugars, and telling them I'll do whatever. I'm very disciplined, and they completely turned me away right from the start. So yeah, that's kind of how my diabetes diagnosis started off, like me ready to do that, but not having any support.
Yeah, it's sad that people, physicians are still giving such false advice. It really is false that we all need tons of carbohydrates. In fact, we don't need any.
I have a couple little screenshots that I've posted on Twitter before, and I use Twitter basically to, you could call it trolling the American Diabetes Association or doctors that put out bad information. I just go after them on Twitter because that's the spot to do it. But I have, when doctors or the ADA say, yeah, there's a lot of support out there for any diet, including low carb, I have a screenshot from different Facebook groups, and I block out people's names. But when someone asks, hey, how about a low carb diet? How about a keto diet? And all the responses are always, the majority are like, my endocrinologist said, no way. My endocrinologist said, you're going to get kidney disease. My endocrinologist said, you're going to get heart disease. No, no, no. It's the majority of the responses are that. And I don't blame these people. I don't blame them at all for not knowing about this. I blame their doctors and their diabetes educators for discouraging them from doing something that could make them healthy.
We have an organization called diabetes.co.uk who, with doctors and nurses who were against the official national health system sort of diabetes recommendation. So they created a counter sort of group, if you like, charity again, non-profit. And they put out a post just a couple of days ago, and I found it very sad because the post, actually, they were very diplomatic with their words, and they said, it was about alcohol with type 1 diabetes, alcohol consumption. It was something like, you, as a type 1 diabetic, you might want to be aware of the consequences. You might, actually, they were so diplomatic with their sort of recommendation, with their words, that you might want to reduce your carbohydrate. They weren't saying don't drink alcohol. And 99% of the comments underneath made me feel so sad. And this is why we have a crisis, not only general diabetes crisis, but also type 1 diabetes crisis. Condition isn't well managed.
And I imagine were they talking about kind of the potential to go low from drinking alcohol, or just kind of general health?
I didn't read the article, but the caption with it was just so diplomatic. They weren't saying don't drink, but just you might want to reduce. And 99% of people were saying, oh, my diabetes specialist nurse said, we don't have to limit anything, or we don't have to.
And there's big pushback against anytime you even suggest that somebody should restrict their diet. And a lot of type 1 diabetics don't want to hear that at all. And again, I don't blame them. I blame their doctors for not educating them on that. And it's really not just the diabetics that should be eating the way like you and I do. It's really everyone is going to benefit from that, because the majority of us these days are overweight and insulin resistant, and it's over half of the USA that's at least pre-diabetic now. That normal blood sugars, normal kind of insulin sensitivity, and normal weight is a minority now. So to suggest that we should just eat whatever we want is not working. It's not working for not just type 1 diabetics, but people with for now working pancreases.
There were a couple of studies recently posted on Twitter about type 1s who who also have type 2, so who are insulin resistant.
Yeah, double diabetes.
And that's double diabetes. So, and apparently it's becoming a lot more prevalent now.
Yeah.
So
Type 1s are more overweight than the general population now too. So it's not, it used to be type 1s are the skinny diabetes and type 2s are the overweight diabetes, but now type 1s are more overweight than the general population. So there's a problem.
it's not surprising, because if
Yeah.
you tell a type 1 to eat whatever they want and just inject
Yeah.
unlimited amounts of insulin, well, they
Yeah.
are going to put on weight.
Yeah, it's a recipe for disaster. Yeah.
Right. So, Dr. Attar, you follow Dr. Richard Bernstein's type 1 management protocol, if you like.
Yeah.
So this is my book, by the way, Any Type 1s. Oh, sorry, the letters will be, but
I've got one here too.
it's always with me. It's always by my side, and I use it as a reference book every now and again. I mean, I can't tell you the number of times I've read it, and then I just open a random page and.
Yeah, it's not my. I have one signed by him at home too.
Oh, perfect! I wish mine was signed, but yeah. So, so let's talk about. I mean, if you are type 1, do make an effort to get the book and read it through. It will transform your health. Dr. Bernstein, tell us more about him, because
well, first I like that you called his book his diabetes management protocol, because a lot of times you mention this book and it's like, oh, that's the low carb diet book, and it's not a diet book. Yes, diet is a very important part of this protocol, and there's a lot about diet in there, but it's not a diet book. It's a comprehensive diabetes management book, and it covers everything on how to that's the goal of this book. The complete guide to achieving normal blood sugars. That is what this book does. And if you can achieve normal blood sugars otherwise, go for it. But really, this is the only way that I've found that works to truly normalize blood sugars, and along with that, to have optimal health too. But yeah, so the diet is essential for it, but there's a lot more to his management style than just the diet. And it's managing your insulin, it's managing blood sugars when things aren't so good, when you're sick. It's what types of insulin to take, how to take it, how to dose it, and so on. So it's comprehensive.
It's very comprehensive. I said I have it by my bedside, and then every now and again I just open a random page and I go, I don't remember reading this. I've probably read it like 100 times so far, but you always discover something new. So I use it as a reference book. He covers everything from type 1 diabetes complications to how to manage them, how to prevent them, how to avoid them, types of insulin, detailed information about the different.
If there's someone watching and you're not want to pick up a boring almost reference book, I would still suggest that you do. But he's got I don't know, hundreds now of videos on YouTube covering basically everything from the book. So yeah, just any topic. If you check his YouTube channel, he's probably got a little video on it. There's that, and then once a month he's doing a teleseminar, so you could send him a question too if you're curious about something, and he usually replies, it's in the book, and then gives his reply, because it almost always is. But yeah, he does that. And then of course the documentary that came out this past fall as well, The Diabetes Solution, that is basically about everything he does and the people that are following this. So yeah, there's a lot of other resources for Dr. Bernstein as well out there.
Yes, and you featured in his documentary, right?
Yeah. My friend Bethany put the documentary together, and they interviewed me in it and a few other names in the diabetes world, and came out really, really, really good, I think.
Do you know where it's available? I haven't seen the documentary.
So it's on a few different platforms. You can rent it on Amazon Video. It's like $3 or $4 or something like that. If I haven't run into anyone who has this streaming service, but I know some people do. Oh, sorry, my phone just. There's a streaming service called Gaia, and it's just streaming on there. You can watch it, no problem. So if anyone has the Gaia network, you can definitely watch it there. But otherwise, Amazon Prime seems to be the way to go to rent it.
Yeah, Amazon Prime is fine. I think that works for most people.
Yeah.
Okay, so if you haven't heard of Dr. Bernstein, and this is the first time you're hearing of him, who is he? Tell us a little bit
Okay.
more about his
So
background.
yeah, he's 88 years old right now, and type 1 diabetic since he was 12. And he, through from his diagnosis to, before he got his blood sugars under control, the management of diabetes was not very good. I mean, even 40 years for you with
Or with type 1, yeah. 40.
yeah. So even your initial kind of half of your life was not, there just wasn't the resources out there, or nobody's even doing it the right way until fairly recently. But so it was like the 1970s, and he was having all kinds of complications already. And he was an engineer. He wasn't a doctor. He was initially an engineer, and he wanted to understand how we could do better, how we could better manage his blood sugar. So he got a hold of a glucometer from his wife, who was a doctor. At that time, you had to go to the doctor's office to get your blood sugar checked, and there was no home testing. Was it like that for you as a child?
It was
Have a
rare.
glucometer.
I remember having a glucometer, but I don't know what age I had one. Initially, I didn't. When I was very little, I don't remember ever having it. But even later, when I had it, it wasn't something I did like multiple times a day, which is what you should do if you're still using a glucometer. I remember just every now and again, I would check it, which actually is just data, useless data every now and again.
Yeah. So yeah, he got a hold of that glucometer, and using his kind of engineering mindset, he started testing his blood sugar with different foods, taking his insulin differently. And at the time too, you just kind of took insulin several times throughout the day and then ate around that. And there was no basal bolus. He basically invented the basal bolus technique, and he invented home blood sugar monitoring. There was no diabetics doing that before him. And then he also figured out that eating a low carb diet made managing and bolusing for these foods much more easier, and much easy to maintain normal blood sugars. And wow, look at all this he just discovered. He tried to get this information published, but nobody would publish an engineer. So so he went to med school in his 40s. Basically, he became a doctor in his 40s so that he could do this work and help diabetics. So he did that, and went on to write several books, and is still practicing at age 88 to this day. And he's healthy and exercises and does everything. Yeah, it's pretty amazing. And I got the opportunity to, when I was a student, he takes in any practitioners that are interested in the field. And when I was a student, I reached out to him, and I'm 45 minutes away from where he practices in just outside of New York City. And I spent 3 days in his office and saw everything that he does, and saw him with a new patient. And I saw the whole experience, what he does with that. He spends 3 full days with a new patient. So extensive medical history, education, and testing too. He does dozens and dozens of tests to test for complications of diabetes, things that most doctors would never even consider. But he tracks all of that stuff so that we can see the progress when you improve your blood sugars and start getting things back under control.
Mm-hmm. And, for any type 1 diabetics who think, oh, this low carbohydrate sort of fat diet, it's all new, and it's all, where did this come from? It's all very new, and, oh, we haven't trialed it yet, and there isn't any evidence. Dr. Bernstein has been running his clinic based around a low carbohydrate diet for over 60 years with great success with his patients. So
the really interesting thing with the patient that came in when I was there too, he was a type 2 diabetic. And at first I'm like, oh, I wish this was more interesting with a type 1 here, but okay. And his A1C was like 5.4 or 5.5. You use the same, you use different scale in the UK, or use the scale? Okay. So 5.4, 5.5, somewhere mid fives A1C. And I'm like, this guy's not even going to have anything to kind of correct, we'll tighten it up a little bit. But no, Bernstein found tons of complications in this guy's tests, autonomic nerves, and a bunch of things came up, which is why he advocates for A1C under 5, which equates to blood sugars averages in the 70s and 80s. So yeah, that kind of, I at that time had that goal to have A1Cs in that range, but I really didn't think it was as important as it really is. And seeing that really opened my eyes.